Great to have you along this afternoon. Thank you so much for listening. It's the Scott Sands Show on News Radio 1370 and 92.9 FM. Everywhere on our free iHeartRadio app. You can find me on social media as well. Twitter, Insta, Facebook. Look for @ScottSands. We're joined now by a couple of members of the Drug Abuse Response Team here with Lucas County Sheriff's Office. Lieutenant Steve Rogers and Tammy Smith joining us now. Great to have you guys on.
Hi, thank you for having us on.
Yeah, Scott, thank you.
Well, we'll start with you, Tammy. Explain what you do for the community and what your involvement is with the DART unit.
Sure. Well, my name is Tammy Smith. I do work for the Lucas County Sheriff's Office. I've been with the Sheriff's Office now for about 14 years. And the last 5 years, I've been assigned to a special unit called the Drug Abuse Response Team. Within that unit, I work as a community advocate. So and what I do is I kind of go around and I try to change the stigma around the disease of addiction. And I do that through education and outreach.
And Lieutenant Rogers, explain your role in the unit.
Yes, sir. Scott, first, again, thank you on behalf of Sheriff Navarre and the Drug Abuse Response Team. Appreciate you having us on today. I'm a lieutenant with the Lucas County Sheriff's Office, going on 15 years of service here with the department. And in January of 2018, I was assigned to the Drug Abuse Response Team, and currently I oversee the day-to-day operations of the multi-jurisdictional unit.
Yeah, it's just in full disclosure, I've talked about this on the show before. I'm a proud board member of the DART organization, and it's great to see the work that you and the entire unit are doing on the streets every day. It's a difficult job. It seems to be even more difficult during the past year and the pandemic. We're seeing the mental stress that the coronavirus has caused for so many people. I don't know if you guys are noticing a difference on the streets, or if you're seeing an increase in the number of overdose calls and drug addiction calls that we're receiving. But it certainly seems like from the stories I'm seeing on a national level that people are unfortunately falling back on addictive behavior during this time of economic and mental stress. Mm-hmm. And that's why it's important to talk about this right now. It is National Drug Awareness Week. What are you guys, have you noticed a difference in, say, 2019 to 2020?
So from 2019 to 2020, we did see a decrease. And actually, Scott, over the last few years, as far as 911 calls go, for being placed through 911 for overdose calls of service, we are seeing a decrease over the last 3 years. It's a slight decrease, but any decrease, in our opinion, is a positive. Is positive. So for this year, I only have the numbers for January so far. I'm still putting together the numbers for February, but we did see 20 less calls of service placed through 911 from January of 21 compared to January of 20. So hopefully that's a trend that's going to continue this year. I know the pandemic really threw a wrench into, unfortunately, a lot of individuals' recovery due to obviously COVID, and in turn, it's made individuals actively engaged in addiction even more isolated than what they felt before. And in turn, it unfortunately causes some to turn back into addiction. So we are still seeing calls for service to local hospitals. We're still responding day in and day out. So yeah, that's why this week is such an important week to educate the community and the public on what to look for, signs and symptoms, what resources are available here in Lucas County, and hope just spread the word as far as how fortunate Lucas County truly is.
We're really lucky actually to have your unit, to have your team on the streets, to have the Drug Abuse Response Team helping with this opioid problem and the drug problem and the human trafficking problem in the Lucas County area. It's really a unique team that many other municipalities and law enforcement organizations are using as a base model around the country now. So it's something that we in this area should be truly proud of. Tammy, explain how the DART unit's not going out busting down meth houses and arresting people. You're actually out there trying to help and get people into a recovery environment.
That is very true. The thing that works for us is that we really are the optimal unit as far as community policing, right? Community policing is about working with the community and of serving and protecting. So what our unit does is we truly do meet clients where they are. And that can either be physically where they are or where they are emotionally or mentally. What we do is, again, an individual will overdose. We go there to that scene and or to the hospital, and then we try to link that person into a treatment agency. Our unit is not a program in itself where we provide treatment, but we utilize the services that are here within Northwest Ohio and in our community, because we have excellent resources in our area. We've actually operated at about an 80% success rate with actually linking individuals since the conception of our unit. So again, very strong positive connections, and it really is about working with that client and working with the community members.
You know, the thing that I think always impresses me when I talk to deputies and members of the DART unit are the personal stories and the personal aspects that the members of the DART unit really have in trying to make a difference in the community. It's not just a 9 to 5 or a 10 p to 5 a.m. job. There are times where you as a member of the DART unit or the deputies are answering phone calls from addicts or people who are in recovery in the middle of the night, even weeks or months after the fact, after that first contact, and you're willing to step up and take time out of your personal life to help maintain recovery for people who want to find that help.
Right. What's interesting is, my family laughs at me because I truly do take my work home with me. Of course, we're not supposed to do that, right? But I do take my work home with me. We all are available 24 hours a day. Very early on in the unit, I actually took my phone on a cruise with me, and I was international, responding to text messages and calls with clients that I was working with. So we most definitely are very connected with the clients that we work with. All of us have a personal story. All of us are connected in some form of a matter, in one form or a matter, as far as having some kind of personal history or a family member that has kind of gone down this road. So it really does mean a lot to us, and we don't mind, giving up that hour on the cruise or talking to somebody in the airport about the disease of addiction. It really is a calling and a passion for every single one of us here in the unit.
And sometimes that's all that person really needs is someone to talk to, someone to offer a few words of encouragement. And depending on who their friends may be or who their family may be, they might not be getting that encouragement and support at home or within their friend group, and they need somebody that can say, "Hey, you're going to be okay. Stay strong. You can get through this."
Yep,
LT,
very true.
I don't want to put you on the spot, but I know you're the numbers guy. Any idea how many people whose lives the DART unit has helped to change in Lucas County? Do you have any total numbers?
Yeah, absolutely. So we do have a database that we track individuals that we work with, whether they accept our offer for assistance or not. And since the inception of DART in July of 2014, our database has entered over 5,000 individuals, with 99% of those individuals residing here in Lucas County. There are occasional times where we do get out-of-state residents that do come here, they use and they overdose, and we have that engagement with them. If that situation does occur, then we still try our best. If they want help, we try and link them to services within their own community. But yeah, since the inception, we've engaged over 5,000 unique individuals here at the Drug Abuse Response Team.
That's huge. That's 5,000 people who easily could have died, to be perfectly honest. I mean, we've seen the ill effects of the fentanyl spread within the opioid crisis and how deadly that the introduction of fentanyl is, not to mention how deadly the opioids or the cocaine and other drugs themselves can be.
Yes. One of the things that we do when we provide education to the community is really stress that point in regards to the fentanyl and the carfentanil. What we're seeing in law enforcement and across the spectrum of mental health and AOD services, we are noticing that all drugs, right, whether it be cocaine, meth, or even marijuana, are actually being tainted or laced with a form of an opioid, whether it be fentanyl or Percocet or Oxycontin. So, we're kind of seeing a new batch or a new breed of individual that's becoming addicted to the opioids.
And as there are more crackdowns on on prescription drug abuse. Unfortunately, it often becomes easier to find the illegal narcotics than to actually get a prescription, and that's even more dangerous. Tammy Smith is with us, Lieutenant Stephen Rogers, the drug abuse response team from the Lucas County Sheriff's Office. As I mentioned at the beginning, it is National Drug Awareness Week. What kind of activities do you guys have planned the rest of the week to spread the word about both the DART unit and the dangers of this opioid crisis that we're still in around here?
Well, we have all kinds of
Tammy, I'll
wonderful
let you answer
things.
that one.
All right, thank you, sir. Thank you. We have all kinds of wonderful things planned. First of all, you have to check us out on our Facebook Live events. They are happening every single day of the week for this week. And then every Thursday at 2 o'clock, we have a Facebook Live event. But tomorrow, we have 2 events that are coming up. We're actually going to be doing a Science of Addiction presentation with Glass City Academy. And then at 2 p.m. tomorrow on Thursday, we're actually meeting with Chrysalis, which is a branch of Harbor Behavior, where we're going to be speaking with individuals in regards to opioids, moms, and babies. And we're going to kind of see that connection and the tie-in with that. And then on Friday is a huge event where we're actually having a drive-through event. I like to call it trick-or-treating for the adult world, where what we're doing is we have over 20 providers. We are setting it up there at Eleanor Kale, which is off of Hillcrest Road. There are 20 providers, and what you do is you come through in your car in a safe environment. We put a bag on the outside, and then we fill it up with all kinds of great goodies and information. But that's on Friday, starts at 11, from 11 to 1.
That's terrific. All good stuff. And by the way, go follow and like the DART's Facebook page, lucascountydart.org, and a new website coming very soon. But follow on Facebook right now and check out the terrific videos that are being done. Learn more about what's happening. And this is, I don't think it's part of this particular week, but there are National Drug Take Back Days that happen around the country. The Lucas County Sheriff's Office can always help if you do have prescription narcotics at home that you no longer need, or maybe someone passed away and had prescriptions, so you can get rid of those safely rather than just throwing them away or leaving them in a medicine chest for years to come for somebody to find. That's not a safe thing to do either.
Yeah, and the one thing, Scott, that I just want to piggyback real quick off of what Tammy was saying is what's so great about our DART Facebook Live events that her and Deputy Whaley at every Thursday is that it highlights every one of our amazing facilities that we have available here in Lucas County. Without the treatment providers and the relationships that we have with these treatment providers, DART wouldn't be where we are today. And that's such a strong foundation here in Lucas County that we truly have to serve the community. And one of the most fascinating things that I ever had the honor of being a part of is I was representing retired Sheriff Tharp in Washington, D.C. at the Bureau of Justice Assistance. And they stated at this meeting, this national meeting, that DART is the earliest known first responder diversion program in the entire country to combat the opioid crisis. So we are miles ahead still, and at this time, unfortunately, compared to other communities across the country. Hopefully other countries will start to implement their own versions of DART, which they currently are. And so we are very thankful and lucky to have what we have here in Lucas County to provide treatment services.
Yeah, we're extremely grateful for what everyone in your unit at the Drug Abuse Response Team does on the streets every day. Thanks to retired Sheriff Tharp and Sheriff Navarre now, and everybody in the DART unit and all of the deputies for doing tremendous work on the streets on a daily basis. Can't thank you enough. Again, more information about National Drug Awareness Week, go to lucascountydart.org, like the Facebook page, get all of the information, watch the Facebook Lives. Guys, thank you so much again for your time.
Thank you, Scott.
Thank you, Scott. We appreciate it.